patients in the film you're about to see are played by actors, but I'm a real GP, and their stories and their problems are very much based on what my patients tell me every day.
Well, I started getting a few funny turns about a year ago. I used to play badminton sometimes after work, and my heart would beat so fast and then feel like it had stopped and then beat fast again, and I could almost hear it hammering against my chest. It was very frightening. I had an ECG which confirmed I have an irregular heartbeat called atrial fibrillation. Well, I have to take Warfarin every day because the atrial fibrillation could lead to blood clots forming. My doctors explained that puts me at risk of having a stroke. The Warfarin helps to reduce the risk of this happening. I keep 3 strengths of Warfarin. Well, at least every few weeks I have to have a blood test to check the clotting of my blood. It's something called an INR. Depending on the results, the doctor tells me which tablets to take until my next test. At the moment I take one pink one, but seems to change almost every time I go. It's hard to keep track of the tablets I'm taking, especially because just as I'm getting into routine, my Warfarin dose changes. It's bad enough when it's just one new dose, but sometimes I've even had to halve pills or take different ones on different days of the week. On top of that, I've got my blood pressure pills, a cholesterol lowering drug, and I take some vitamins to hold off old age. The other problem I found is that there are lots of things you can't take with the Warfarin. I had a cold a while ago and the pharmacist told me to take a hot flu drink. Well, it contained aspirin, and when I had my INR checked, it was very high. I should have checked the label or told the pharmacist I'm on Warfarin, but I didn't really think of those drinks as medicines. I now know to check and recheck the contents of any medicines, even my vitamins. Better to be safe than sorry. Today I've got an appointment with my doctor. I get my INR result. I'll go into the office first, get a couple of hours of work done, and then I have to take a couple of hours off to go to the doctor. Well, I suppose I should think myself lucky. I know some people have to travel miles on the bus to the clinic. One of my friends says he writes off half a day every time he gets his blood checked. I have to go every 3 or 4 weeks, but if my INR levels go astray, I have to go more often. It's a worrying time. Any time between measurements, my INR could be out of range. If it's too high, I'm at risk of a serious bleed, but if it's too low, it increases my risk of a stroke. Then, if I do have to adjust my dose, it still takes time until I'm protected again.
Well, a couple of months ago, he needed a serious dental procedure. He stopped his Warfarin well in advance, as his doctor had told him, but the treatment still couldn't go ahead because his INR wasn't low enough. The dentist wouldn't do the work because of the higher risk of severe bleeding. It's inconveniences like that that really seem to get John down. We're planning a holiday at the moment to visit our daughter in America. Well, John is already getting anxious about the flying. What if his INR is wrong? How will he get his blood tested while he's over there? How would he cope with a change of diet or a tummy bug? And on top of all that, well, his holiday insurance is so much more difficult to sort out now.
Okay, well, the good news is your INR is 3.6. Now, that's good because obviously it means you're taking your tablets, which is great because I have to say I've had several patients in today who just, they find it so difficult to take them reliably. And that means the INR goes up and down. It may be down at a level where it's going to increase your risks. Do you remember we said that we wanted it to be between 2 and 3 on the Warfarin tablets?
Yeah.
Okay. Well, obviously 3.6 is a bit above that.
Okay.
Can you think of anything that you might have eaten or taken differently since we met last 4 weeks ago?
I can't think of anything specific. We've had dinner out a few times, but I'm always careful to watch what I eat and drink.
Okay. And I know it's really difficult to keep track, but obviously it's not just alcohol that can affect your INR, and it's not just the green vegetables either.
You know, sometimes I can pinpoint immediately what's caused my INR levels to go up, but often I can't identify any reason.
Okay, let's have a think. You're taking these ones at the moment.
Yes.
So the pink ones, that's the 5 milligrams. Now the good news, I'm not going to ask you to take one tablet one day and one tablet another day like we did last time, okay? I know that was really difficult to keep track of. But what I am going to ask you to do, the computer says that we need to give you 4 milligrams a day. So that's one of the brown ones, 1 milligram, and one of the blue ones, the 3 milligrams.
Right.
Okay, one of those each? Okay.
Okay.
People who have atrial fibrillation, or AF as we call it, are at much higher risk of a clot, and that can cause them to have a stroke. In fact, we know that people who have AF are probably 7 times more likely to have a stroke, and when they do, it's often a much, much more serious stroke. Now, given that about 1 in 100 people in the population overall have got AF, and 1 in 10 people over 75, you can imagine the size of the problem. There is a lot that we can do to help people who've got AF reduce their risk of stroke, mostly by reducing the stickiness of their blood. And we do that by using medicine called anticoagulation medicine, like Warfarin, say. Now, if you use Warfarin and you get the blood clotting in the right range, you can hugely cut the risk of stroke. But there are lots of disadvantages. There are endless restrictions on people. Apart from anything else, you have to adjust the dosage all the time to get the INR in the right range. If it's too high, then they could be at increased risk of bleeding. If it's too low, they could be at increased risk of stroke. And unfortunately, people, because they're having to adjust their dose all the time, find it really difficult to keep up with the changes. We know that if you change somebody's drug dosages a lot, and if you make it much more complicated, they're much less likely to take it. And that's why, especially when people are starting out on their medication, they often take it really irregularly. They keep forgetting, or they take the wrong dosage. What's perhaps most worrying of all is that a lot of people just stop completely. And that means, of course, they are completely unprotected against this increased risk of stroke. It's not just the endless visits to the doctor, the constant changing of the dosages, all the restrictions there are on people's diets. That's bad enough. But there's also the fact that patients worry all the time. Next time they go back, are they going to discover that their dose was too high so that actually they're at risk of bleeding, or were they underdosed so they're at risk of having a stroke? That can have a real impact on the quality of patients' lives, as well as making things more awkward.
It's such an inconvenient part of our lives, that I do need to be reminded every now and then it's worthwhile taking Warfarin. Don't I, darling?
Yes.
Obviously, it's not as bad as having a stroke.
Which is what makes John stick to his therapy, even though it's hard to control the risk of bleeding. We've banned John, though, from using the hedge trimmers, just in case.